Okay, so right now we're going to practice hip hinging. So if we have a chair, which almost always helps because that's the one time that most patients know how to hip hinge is when they got a chair behind, because if you don't hip hinge and you go to sit down, you're going to miss your seat. So we use that to our benefit. We want to make sure they know the chair is there and that they're secure and safe, and tell them to push their hips back even before they start bending the knees, shifting that weight back into the butt and the heels, bending, kind of bowing here, keeping that weight balanced and centered. You want to have your center of mass between over your base of support, which is basically right between the arches of the feet, and then bending those knees as you come back and down to a nice soft landing. So same thing with getting in and out of a chair. This is the easiest way that I've found to teach pretty much any patient to do a sit to stand in a matter of just a few seconds or a few minutes anyway. Just get your center of mass over your base of support. You can scoot forward to get your center of mass forward, pull your heels back to get your base of support back. Think about an elevator shaft here. Get your chest, your person in the elevator, you're down at the lobby, going to drive down, lift straight up the elevator shaft. Don't swing the hips forward. Keep your hips grounded back up here. And then we're going to go all the way back down to the lobby until the butt hits the seat. That's the ding of the elevator when you get down to the ground. And then you can get out of the elevator. So it's hinge the hips coming up, hinge the hips coming down. If we're squatting, same thing. Hinge those hips, butt back. Keep your weight centered so you can ground through your heels with your weight balanced between your arches, and that gives you good control. And you can do this at the wall for squats. You can do lifting, slides, all kinds of stuff with that.